Next, another group of people are there. They are called asymptomatic cases, maybe you and me. What really happens? The organism enters, it multiplies, the immune system is very strong, the antibodies are produced very quick. Immune system, because it produces a lot of antibodies, it prevents the multiplication, and even if it is multiplied, it kills the organisms most of the time. So automatically, because it kills and the organism multiplication is stopped by the immune system, you may not have typical symptoms. All these may be very mild. Before you go for a test or a suspect, you become all right. More of antibodies, very good immune system, they destroy it. But remember, the organisms are destroyed, but the immune system remembers this organism, number one. Second, the immune system has produced an antibody. That antibody will be there circulating here. So for these people, the rapid test will be positive, but you may not get a history from the person that he had suffered from this problem, because he doesn't know that he had an attack. Before doing a test and confirming, because of the less symptoms and signs, he is not bothered. So automatically he recovers, and you call it as the other one is a clinical disease. This is called a subclinical disease, in which the patient recovers without suffering from the disease, or that is without having any symptoms. He recovers from that attack. You call it a subclinical disease, an asymptomatic case. But the evidence will be there in this person. What is that evidence? Those antibodies. So for this person, no virus after recovery, but only antibodies will be there. So these people will be positive for rapid test. This. Just see this picture. There is a man. Take him as a virus. And he has applied a perfume, a scent. Okay. Now what happens? This man enters this room and he goes away. Comes in and goes out. Now you are entering into this room. You will see the smell, the scent smell or the perfume smell. Immediately you will ask a person there whether this particular person has come. Now he'll say yes. Then you will ask, how do you know? He says, the perfume smell is there, so I thought yes. Now what you will do? You will try to see whether that person is inside. Okay. And the other person says, he came and he is gone. He is not here. The same situation you can. The smell which he leaves behind is antibodies. The person, his antigen are the virus. That means by just experiencing the smell, you suspect that this particular person has come. Either he will be there, so he has gone. If you want to see whether he is there inside, that is confirmatory test. The smell of the scent or the perfume, that is nothing but equal to the rapid test. That means the smell raises a doubt that this person has come and he may be inside, or he might have gone. If he is in, you will see the person, that is confirmation, that is a confirmatory PCR test. The smell is equal to the rapid test that creates a doubt in you that this person has come. So this is how I can just compare the rapid test for the perfume smell and the confirmatory test for the presence of the person inside the soap. Having known about this rapid test, how does it come in a pack? It comes in a pack. You call it COVID-19 antibody test kit. You will have a test cassette inside. You have a small capillary tube and you have a small buffer fluid, and you have the test instructions. This antibody, I told, there are 5 types of antibody, and in this type of diseases, 2 types of antibodies are involved. One is called the IgG, the other is IgM. Let us not go into deep into this, but we see these two presence of this IgG and IgM. So these are the names of the antibodies tested. So this is the package which contains this cassette. You see on the left hand lower corner there is one B, one S, one IgM, IgG, C. We put a drop with that capillary in the pit. Yes, you see the red color there. We are putting a drop there. After that, you are adding a buffer solution into the pit B. This buffer solution and the blood will diffuse into the small area up to C. Okay, C is control. The role of control C is that this blood has diffused up to that level. Then only you can cross IgM and IgG. This test is almost equal to the pregnancy test, and you will see the rings, the band, a pink band, and if the IgG band is red, then you are positive for IgG. If the IgM band is pink color, then you are positive for IgG. The last C will always be pink to show that the blood has diffused up to C without any disruption. So in the last thing, you have 3 lines. That means IgM is positive, IgG positive, and the control shows that the blood has diffused up to that level. So this rapid test is positive for that person. After doing this, if this is positive, then you will go for a confirmatory test. Second point is, if this test is negative and he is there in a hot spot where a lot of people are there, or he is there in a place where a quarantine is there in that area, you will not leave him. You will wait for another 5 days or 6 days or 7 days, or you will wait whether he gets symptoms and all. So you will have to repeat this test so that a person may be incubating. During incubating period, you may not get this positive. So he may get a symptom after 5 days. At that time, you repeat this test, he may become positive because the antibodies are produced just after the incubation period. A negative person becomes positive after 1 week. Now you do the confirmatory test. But what I say is, a negative test of this rapid test will not rule out that he is not a case, or he is not going to get, or he is not incubating. A positive case also does not say that he is having the problem. On anything you are going to do either a repeat rapid test, or if the rapid test is positive, you are going to do a confirmative test. So this test raises the doubt. This test says he may have this problem, or the organism may be there inside one, or this test, if it is positive, says that this person had a problem, he has recovered from it. So the inference from this is, if it is positive, either he is suffering from the problem or he has come out of the problem after recovery. He has suffered and recovered. 2 things. If it is a negative test, we have to repeat if he is at contact, if he is in a hot spot, and if you suspect that he may be incubating this, then you have to do this again to see it's positive. But whatever time you wait, if this test becomes positive, you will not confirm that he is having the problem unless you do a PCR confirmatory test.